All right. Good afternoon, everybody, and welcome to today's webinar. Since all of us just got our Spotify Wrapped last week, we thought it'd be kind of fun to bring you AvaSure's biggest hits of 2025 in our own AvaSure Wrapped session. This year, we rolled out a ton of new innovations. So today, we're going to bring those top tracks back into the spotlight to make sure that you're up to speed on everything that's new with AvaSure. And in the spirit of Wrapped, I would love for everybody to drop their top song or your top artist into the chat. My top artist was, funny enough, Pink Noise, because I need that to sleep to. So very anticlimactic, not very exciting. So I hope you all have more exciting ones than I do. So go ahead and drop those into the webinar chat. To get started with introductions, my name is Nicole Babinek, and I am the Industry Marketing Manager here at AvaSure, which basically means that I get the privilege of working very closely with our customers, with our partners, and our product teams to understand what's going on across the industry and sharing those great insights back with you all. So Brad, I'll pass over you to introduce yourself, and don't forget to include your top artist of the year.
All right, Nicole. So hi, everyone. I'm Brad Smith. I'm the Principal Product Manager here at AvaSure for Artificial Intelligence and Interoperability. It's really my role to make sure that these solutions we provide solve clinically relevant problems while reducing the technical burden on both patients and caregivers. And Nicole, when you talk about my favorite artist, it really was a battle between Saja Boys and Huntrix. And so I did thorough analysis. I'm an AI guy, and it appears that for every 6 times I played Saja Boys, I played Huntrix 7 times. Who knew?
I do need to watch the K-pop Demon Hunters movie, so that is up on my list for Christmas break, but I see what you did there. All right, so before we jump into the webinar, I did want to take a moment to celebrate some of AvaSure's biggest moments from the year. In 2025, we supported over 48 million minutes of patients observed across the country. That is nearly 4 million minutes per every month where someone's mother, father, child, or loved one was kept safer because a trained observer was watching out for them. And we are at our core just so incredibly proud of that achievement. Our top track for the year was the AvaSure Symposium 2025. So I'm sure some of you had attended that with us. It was truly a fun time. You can see me in that picture on the right there in my complete Canadian tuxedo, dancing on the dance floor. So we were really happy to invite over 150 attendees from more than 45 health systems and welcomed over 25 speakers to the stage to share their real world outcomes and their lessons learned from scaling their virtual care programs. We are so proud of these milestones and even more excited to see these numbers grow as virtual care continues to scale in 2026. So that's a great start to the celebration, but here's what's on our playlist for today. So first up, we're going to kick things off with the Dual Flex Drop. This is our breakout single of the year. Next, we'll slide into the Continuous Remix. Really think of this one as our next gen sound. It's smoother, it's faster, and it's built to grow. Then we'll jam through our collabs that hit the charts, where we'll highlight partnerships that helped us make new sounds and amplify our impact this year. And of course, we could not leave out AI and Vicky. She's our fan favorite track. So we'll talk through how AvaSure is leaning into AI in a way that's smart, responsible, and actually useful for caregivers. And finally, we'll close things out with the Remix Hub. This is our all new virtual care hub and a little bit of a sneak peek into what we have coming next year. This is going to be the central place to bring every workflow, every device, and every team together. So sit back, turn up the volume, and let's relive AvaSure's greatest hits of 2025. All right, starting with our biggest headline of the year, the Dual Flex Drop. This was our biggest release that our customers are most excited about. This device here is all about flexibility. It's designed to fit every room, every workflow, and every vision for virtual care. And here's some of the things that it lets you do. First and foremost, it is fit for any room. It's a versatile device that adapts to any unit, whether it's med-surg, ICU, ED, and beyond. It can be mounted above the TV, on the wall, or on the ceiling to fit whatever you need in your space. But this device also integrates with the in-room technology. So for example, virtual encounters can be displayed directly on the patient's TV through your entertainment system or your interactive patient communications vendor, kind of like what you see on the image here. This device has always-on artificial intelligence. The fixed camera on the bottom there visualizes the entire room and continuously runs AI models both on the device and in the cloud. This allows it to quickly detect things like potential falls, elopement risks, or when a room is ready for turnover. This AI works quietly in the background without disrupting clinical workflows. And because that AI can process information instantly and continuously, it helps staff to respond faster, stay proactive, and keep patients safer without adding any extra steps for bedside staff. And this device has high impact visibility and sound. The pan tilt zoom camera on the top there delivers 4K resolution, night vision, and a 30 times optical zoom. It truly is sharp enough to read the fine print on a patient band or a medication label. We have this device at trade shows, and it is amazing because we can zoom this thing in 50 yards across the floor and still be able to read someone's name badge. It is truly that crisp. The microphones on this device are tuned to focus in on the intended speaker without picking up unnecessary background noise. And that alarm output is loud enough to be heard from down the hall. This design is amazing. We have truly refined this device over more than 15 years. We know what works best in real clinical environments. We've done the work, we have learned the lessons, and this dual flex is truly a combination of that experience and that expertise. And last up, dual flex in motion. So next year, we're going to be dropping the mobile version of dual flex. We're going to bring this powerful technology to serve on-the-go uses like telestroke, virtual rapid response, and specialty consults at the bedside. So this device is truly a game changer for our customers. We've received amazing feedback about it thus far, so don't wait to get your hands on one. Now I'm going to pass it over to Brad to talk about our next hit. So Brad, let's hear about the continuous remix.
All right, so I consider myself a little bit of a dual flexer myself. So thanks, Nicole. That was a really good, it's a really good transition over. But next up in our Wrapped lineup is what I like to call the continuous remix. It's really that reliable, always on track that plays in the background of everything we do. And this year, one of the biggest evolutions was the advancement of our web-based continuous platform. And just like any good remix, it really elevates what was already working. We want to give hospitals a smarter, more flexible way to scale virtual care. So jumping into continuous. With continuous, everything runs in the browser. No installation, no heavy IT lift, and because it's web-based, it really allows clinicians to monitor patients from anywhere, as well as increase a scale from one single view of a patient, but up to 36 patients at once. And even more exciting is that view is now augmented by AI. Hey, I'm an AI guy here, to support high-risk scenarios like falls and elopement monitoring, which really gives teams more confidence and more coverage than ever before. This is really what scaling virtual care looks like. And now let's talk about the new use cases that joined the stage this year. Health systems are using the AvaSure platform for high volume observation units. They're using it for safety monitoring in ED hallways, behavioral health support, step down in med-surg environments, virtual nurse support for lower acuity patients. And honestly, as AI continues to evolve, we expect the set list to grow fast. There's nothing that our platform can't accomplish. And we're wanting to prove it. So while we can't talk about continuous observation, we can't really talk about continuous observation without talking about a major research milestone this year. We launched an IRB-approved study to validate how our falls and elopement AI can safely expand virtual sitter ratios. That's something that health systems have been asking about for years. And for those of you who don't know, IRB stands for Institutional Review Board. And IRB is an independent ethics board that ensures any study involving patients is conducted safely and responsibly. This study will actually help answer one of the biggest questions in virtual care today. How can AI enable healthcare teams to monitor more patients safely without compromising care quality? And we're incredibly proud of where this research is heading. We'll have much more to share as we continue generating evidence. That's the continuous remix. It's the track that kept the whole album moving along this year. It's reliable, scalable, and even stronger as AI turns up the volume. And the best part, the beat never stops. Every new workflow, every new use case just adds another layer to the sound. And as we head into 2026, continuous is really going to keep the rhythm of virtual care steady, adaptive, and ready for whatever remix comes next. And with that, I'm going to drop the mic and hand it over to Nicole to take us to our next track.
Great. Thanks, Brad. I love hearing about the IRB study. It's so important that we take a look at those outcomes. We hear from customers all the time that honestly, they're tired of hearing big AI claims without the studies, the proof to back it up. So we are very committed to making sure that everything is backed with real data and outcomes. So very excited to hear about that. Moving on to the next step here is one of my favorite parts of any good Wrapped moment. It's the collabs that hit the charts. So you know how artists sometimes team up for those surprise hits. One of my favorites is Dua Lipa and Elton John 2 or 3 years ago. They came together for Cold Heart, which was an absolute banger. Well, AvaSure has had its own version of that this year with major collaborations, new integrations, and even an acquisition that really shook things up in 2025. So first up, I have what I'd like to call our chart topper this year. It's the Epic Toolbox designation. And this is huge. And what makes this so important is what it means for you and your teams. It really shows how deeply AvaSure integrates with Epic and how committed we are to making virtual care workflows native, seamless, and scalable. This integration supports key workflows like virtual visits that launch directly from Epic user interfaces. It supports Epic Monitor for continuous patient observation, and also integrates with MyChart Bedside TV for a better patient experience. So this achievement really places AvaSure exactly where you want us. It's integrated inside of your largest IT investment. It helps to reduce friction for clinicians to help with adoption of newer solutions. And it also helps to enable virtual care at enterprise scale. This is a massive milestone for us. We're so excited to bring it to our customers. It's absolutely one of our chart toppers for this year. Next up on our playlist, this year we launched our integration with Suki. With Suki, we're bringing ambient documentation and virtual care into the same experience. This helps nurses and clinicians spend less time wrestling with charting and more time caring for their patients. In October, Suki kicked off an initiative to really tackle the administrative burden on nurses. This includes forming an inaugural nursing consortium with top health systems. They're shaping Suki for nurses. It's a solution built for real nursing workflows and designed to integrate with leading EHRs like Epic, Meditech, and Oracle Health. And our partnership brings that innovation directly into virtual care. In the first phase of our integration, virtual nurses and physicians can use Suki with AvaSure to complete visit documentation and admission or discharge forms completely hands-free. In phase 2, we will support ambient documentation at the bedside without interrupting care. So think of it like using Alexa today. I just activated mine. I hope I activated yours too. So when you say a wake word, Suki starts to capture the documentation using the microphone in the AvaSure device that's already in the room. So it lets nurses stay with their patient instead of turning away to chart, so they can stay fully in the moment and create a better experience for everybody in the room. It all adds up to one thing. At the end of the day, it's more meaningful time at the bedside. Next up is our partnership with ASCOM. This is a collaboration that's taken our platform's responsiveness to the next level. This integration connects AvaSure's virtual care platform with ASCOM's healthcare platform suite and Myco devices. So that means stat alarms go straight into the communication tools that your teams already use, and that patients can even ask for a virtual nurse right from their pillow speaker. So together, we're creating a tighter, smarter, and more coordinated response loop across the care team. This integration really helps to promote patient safety by ensuring urgent needs reaches the right clinicians instantly. It accelerates clinical response with faster routing and fewer delays. It helps to elevate care experiences for both patients and clinicians through smoother and more coordinated workflows. And lastly, it creates that interoperable ecosystem that unifies alarms, communications, and virtual care into one connected environment. Truly, the vibe here is pretty simple. Faster routing, faster response, safer patients, better outcomes. And this is really only the opening track of what we're going to be doing together. And finally, the last collab that was more like a surprise album drop was our acquisition of Nurse Disrupted. AvaSure officially brought Nurse Disrupted in earlier this year, and it's already making a meaningful impact. As a nurse-led company, Nurse Disrupted shares our passion for clinician-driven innovation, building solutions that truly reflect the realities of frontline care. Their platform strengthens our virtual care capabilities in both home-based settings and expands how we support clinicians in those tough-to-staff environments. We didn't just gain the technology, though. We welcomed in an incredible leader. Bree Laughlin joined AvaSure as our Executive Director of Innovation. She is a nurse through and through. She has deep expertise in virtual care, clinical workflow design, and high complexity deployments, including her experience as a nursing executive at Epic. We are thrilled to have her with us. And she's now helping to shape how we scale virtual care and extend our reach into new care settings. We cannot wait to see the types of things that Bree brings with her nursing-led background, her experience at Epic, and her passion for making workflows that make sense. So next up, I'm going to pass it over to Brad to tell us what's new with Vicky.
Nicole, this track's been heating up all year and is a certified fan favorite. It's Vicky. In 2025, AvaSure made major investments to expand AI across the platform. We wanted to focus on actual results, not experiments, but real AI solving real problems. With that, we focused on embedding our AI into devices and workflows. We also wanted to make sure we used AI to reduce clinician workload, which powered smarter, safer, and more connected care environments. And Vicky is really what helps tie everything together. She's our ambient AI agent that brings intelligence to the bedside without adding more tech for nurses to manage. So here's a quick snapshot of your Wrapped recap. Vicky's always on awareness of patient and room context. She has smart prompts that reduce workload and enhance safety. She's really designed to work hand in hand with our virtual care platform. She's built to scale across the enterprise, not just in isolated units. She's proactive, she's insightful, and she's quickly becoming a fan favorite. And obviously, every star has a team behind the sound. For Vicky, it's her powerhouse partnerships with Oracle and NVIDIA, which help us deliver the high-performance computing and scalable infrastructure that help make her shine. These collaborations are what transform AI from a cool demo into a platform-wide capability, or really a platinum track, right, Nicole? They set the stage for even bigger things in 2026, AI that's faster, smarter, and seamlessly woven into care delivery. And so now, the moment you've all been waiting for, every great artist has a signature move, and of course, Vicky's is no exception. So in true Wrapped fashion, let's give her a little love. Hey, Vicky, you're so fine. All right, and that's track 3, Vicky, who is our breakout artist of the year. She's smart, scalable, and setting the stage for a whole new era of AI-powered care. But every great act needs a place to perform, right? So now let's turn up the lights and step into where it all comes together. Nicole, let's talk about the command center, or the Remix Hub.
Thanks, Brad. Those are some killer dance moves, Vicky. So next up on our 2025 Wrapped is our virtual care hub. So think of this as the playlist that finally organizes your entire music library. No more jumping between album, tabs, or apps. The virtual care hub brings everything into one clean and customizable view. Patient lists, schedules, key information, all tuned perfectly for your role. So whether you're a virtual nurse, a virtual safety attendant, or a specialist conducting a virtual visit, you're going to get tailored experiences that cut out the noise. The virtual care hub is smart enough to understand the type and urgency of each request, helping care teams prioritize where they're needed most. It's truly the foundation for where we're heading next. A world where virtual care workflows live in one place, speak the same language, and scale across your enterprise without missing a beat. The virtual care hub is the start to a whole new era in how clinicians see, manage, and coordinate virtual care. And you're going to be seeing a lot more of this in 2026. So now let's hear it for our outcomes that our customers achieved earlier this year. Brad, what are some of your favorite stories?
Well, all right, cue the lights. It's time for the encore. This is really where the hits of 2025 take center stage. We want to spotlight customer stories that dominated the charts this year. These are the kind of wins that happen when virtual care meets bold leadership, smart workflows, and real human connection. Across the country, health systems turned up the volume and scaled their programs and dropped game-changing results that prove that virtual care isn't just a side act, it's a headliner. So let's talk about the first one, Hackensack Meridian Health. New Jersey's largest health network took the stage with a vision to remix the bedside experience. They wanted to empower nurses, improve outcomes, and put patients center stage. They started with a pilot for admission and discharge support, and then Hackensack Meridian Health handed off task-based work to virtual nurses, which allowed them to free bedside RNs to perform meaningful patient care. In just 1 year, they saw results. They saw 11.6 reduction on length of stay, a 26% cut in RN overtime, a 65% reduction in RN traveler hours, and a 0.68% reduction in readmissions. These outcomes were powerful enough to drive a system-level decision. So now HMH is expanding virtual care with devices installed in every single patient room. This is a model of how strong leadership, clinical performance, and clear goals can transform care delivery, which sets the stage for virtual nursing to become a core part of their strategy going forward. Next up, Advocate Health. They transformed a seasoned virtual sitting program to a clinical powerhouse. By fine-tuning how high-risk fall patients were identified, they dropped the number of at-risk patients by 48% and reduced the total number of falls by nearly 30%, outpacing every single non-pilot unit. Their success is now fueling models in pediatrics, perioperative care, and substance use withdrawal, proving that targeted virtual care delivers measurable and scalable impact. Finally, Tucson Medical Center. Fresh off an AVA Prize win, Tucson Medical Center set out with a simple mission. They wanted to ease the burden on bedside staff while maintaining staff retention into the program. Using our episodic virtual care platform, they improved efficiency, diagnostics, surveillance, patient teaching, and professional presence, all without missing a beat. The result, patients feel the rhythm too. With higher comfort, stronger engagement, and a reassuring sense that care is always in tune, word is spreading fast across units, and now everyone wants in on this new sound of nursing. So honestly, these are the stories that make you want to hit replay. These are real outcomes, real people, and real results that prove virtual care has found its rhythm. Each success you just heard is more than just a stat. It's the sound of healthcare evolving. Everyone hears that, right? I hope you did. Together with our customers, we've turned innovation into harmony and 2025 into a record year. So now, as we pass the mic, let's keep the beat going and set the stage for an even bigger sound in 2026. Take it away, Nicole.
Thanks, Brad. Love hearing the amazing things our customers are doing. And I think I heard that a little bit too, Brad. So that's going to bring us to our final track of today's wrap session, the tune in next year. So get ready because AvaSure is going on tour. We're going to be hitting all of the major stages in 2026, and we would love to see you there. You're also going to get plenty more of Vicky, who will be making special appearances and even showing off those famous dance moves. There might even be a real live Vicky. I don't know. You're going to have to come find out. So here is a sneak preview of where we're going to be on the road next year. And at each stop, we're going to be showing you our latest innovations, giving live demos of what's new in virtual care. We're going to share our customer success stories and host meetups that you can connect directly with our clinical teams, our product teams, and with our executive teams. These events truly are a great chance to see what's coming, to ask questions, and really get hands-on with the tech that's shaping the next era of care. If you or your team is planning to attend any of these meetings, we would absolutely love to connect. So feel free to reach out to your account executive to schedule time with us, or follow us on social media and subscribe to our newsletter for updates on where you can find us on the show floor. And speaking of, if you do want to stay in the loop on all things AvaSure, where we're headed, what we're launching, what's coming next, sign up for our monthly newsletter and our quarterly What's New with AvaSure webinars. That way you'll be the first to know when we drop something new. So you can sign up by following the QR code that's on the screen here, or just use the link that we had dropped into the chat. Thank you. And before we sign off, I did just want to say a huge thank you to all of you who partnered with us this year. Whether you were there for us for the full set list or you jumped in for your favorite tracks, we are so grateful for your partnership, your feedback, and the incredible work that you do to push virtual care forward for your patients and for each other. This year was really big, but 2026 is shaping up to be even bigger. And trust us, we've got more exciting drops coming next year. More AI, more partner collabs, more innovation, and more ways to help health systems build scalable, intelligent virtual care models that deliver real results. So thank you all for joining us today, and have a safe and happy holiday season.